Hello, I'm Dr. Laura Murillo, President and CEO of the Houston Hispanic Chamber of Commerce. It's with great pleasure that we welcome our first guest. He's a cardiologist. He's going to talk to you a little bit about the phenomenal work they are doing at the Texas Heart Institute Center for Cardiovascular Care. He is the president, Dr. Eduardo Hernandez. Welcome.
Thank you for having me.
Absolutely. So I know that this can be sometimes a scary topic, but prevention is clearly imperative. And I'd like to just begin with a little bit about some of the work that you all are doing, your centers of excellence, as a starting point, please.
Well, we have been participating for over 2 decades in Center of Excellence programs that involve the professional staff at the Texas Heart Institute with 2 large oil and gas companies, Shell and Motiva. That program has been very successful at both early detection of disease in the population of employees at those facilities. It's provided great patient satisfaction and at a cost savings to the employer because these patients are not going to the hospital with heart attacks and strokes because we're getting to them earlier with aggressive preventive therapies.
And that's so important, the prevention and being aware of it and scheduling regular visits to your doctor, especially your cardiologist. Now, in the last 5 years, as with a lot of sectors, tremendous changes. Can you please talk to us about some of the advancements over the course of the last 5 years?
Well, we've seen remarkable advances in medical therapies and invasive therapies. From the medical therapy standpoint, we have many drugs now that not only treat, let's say, your blood sugar, but in addition to lowering your blood sugar, they prevent heart attacks and strokes. Drugs such as Ozempic or semaglutide, which many of us are familiar with because they're very popular for helping us with weight management, also have significant impacts on risk of cardiac events. In addition to that, we've seen tremendous strides in minimally invasive treatments for conditions which in the past had required open heart surgery. We're able to replace and repair valves without having to open the chest, or using robotic therapy or minimally invasive techniques, which allow patients to either leave the hospital the next day, when in the past they would have to be in the hospital for a week. And exciting things that are coming down the pipeline that are being studied here at the Texas Heart Institute are treatments such as stem cell therapy for the heart, and a total artificial heart, which we hope to start enrolling soon, patients for that study.
So on that note, certainly AI is playing a big role in many industries. What role, if any, is that playing specifically in cardiovascular disease?
I think we're seeing this field evolve rapidly. I think initially we're seeing the use of AI in the clinic, in allowing physicians to evaluate the patient with, just to give you an example, there's ambient dictation right now where the AI can hear you while you're speaking to the patient and write the note. As you know, when you go to a physician, a lot of times you see them spending a lot of time on that computer. This allows you to really converse and spend time face-to-face with the patient. What we're going to see in the future is going to be the improvement in earlier detection of disease, because the artificial intelligence will allow to see things that as an individual human is hard to detect earlier on. An example would be I can predict when someone's going to have a heart attack potentially because they've been going to the office more often, and they're adding the changes in cholesterol and blood pressure to facilitate earlier detection of events.
Well, and certainly we're seeing more and more advancements. You've been in this field for a very long time as a leader. What would you like to convey to the audience before we end our interview?
I think we're seeing continued increase in the morbidity, mortality of cardiovascular disease, and early detection and early institution of lifestyle change can have an enormous impact on our population. So very important to have an evaluation, to check your cholesterol, your blood pressure, your blood sugar, and to institute a healthy lifestyle with daily exercise and a healthy diet, a healthy diet that's rich in vegetables, fruits, low in saturated fat, low in refined carbohydrates. That's going to have a huge impact on our population moving forward.
Thank you so very much for all that you do. We appreciate the partnership we have with the Texas Heart Institute Center for Cardiovascular Disease. Doctor, thank you so much.
Thank you.